On January 1st, 2011, a part of President Barack Obama's health care plan went into effect. It's known as the medical loss ratio.
What that states is that 80 to 85% of every premium dollars consumers pay to insurance companies, those insurance companies must turn around and spend that 80-85% of the premium dollars on health care costs, leaving 15 to 20% to cover any type of overhead costs that that insurance company may have, which is not a very big margin at all for covering some of those type of costs that they have.
The federal government is trying to dictate to insurance companies if they can even make a profit. Let me tell you something. If a company can't make a profit providing an individual insurance, they're not going to take the risk of providing that individual insurance. And so it's designed by its very nature to drive the private insurance industry out of business.
Fine print in the MLR has been a turnoff for a number of organizations, including the most famous restaurant in America.
Another area we're concerned about is a waiver they've created for these mini-med plans, which are very much like a comprehensive medical plan, except there are lower annual benefit limits, say like capped at $2,000. This created a stir back in September when McDonald's came out and said that 30,000 of their employees were going to lose their health care benefits due to this regulation, the medical loss income ratio, because it didn't meet the high expectations and high standards that the medical loss ratio is setting.
There's another concern here. A recent 60 Minutes report showed that over $60 billion a year is generated in fraudulent health care claims. The MLR makes it hard to track this.
There's a lot of companies out there that would have to go and investigate claims to see if they're real, such as people going around saying that they're part of a prescription drug company. They go to the elderly and try to sell them, cheaper prescription drugs, take their money, say that, we'll send your package along the way, and they've basically ripped them off. Insurance companies need investigators to go investigate these claims that look suspicious, and yet this, again, is another area that gets lumped into their administrative costs.
Insurance agents will be impacted because the health insurance companies will not be able to pay them. Insurance agents are not going to come to your company to tell you how your insurance works and how you can use those benefits to help your family.
Bottom line, the medical loss ratio has raised a number of concerns.
As they say, the devil is in the details, but in this case, it's also in the outcome of what the medical loss ratio is going to create in the health insurance industry.
By eliminating the capacity for an insurance company to make a profit on the service they provide, they're effectively going to wipe out a large number of insurance companies. And more importantly, they're going to wipe out the insurance coverage that the people of this country depend upon.
Frank McCaffrey, Americans for Limited Government.